right. Hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I am your producer, Jeremy Carr, here with your host, Heather Pierce, who is now going to tell us what we're doing today. So what's on our agenda for today, Heather?
Today we have Dr. Sheena Menezes with Simple Health Kit. She is coming to tell us about all the really cool stuff that she's doing around access and transparency and all the things that we care about in healthcare. So
there you go.
Yeah.
There you go. All right.
That's it.
Without further ado, jumping right in, here's our conversation with Dr. Sheena Menezes from Simple Health Kit.
Hi, and welcome to the Healthcare Uprising podcast. Today we have with us Dr. Sheena Menezes with Simple Health Kit. Welcome to the show, Dr. Sheena.
Yeah. Thank you for having me, Heather.
Yeah, we're so excited to finally make this happen because, side note, we were supposed to record like late August last year, and then my husband fell off the roof, and I was like frantically like emailing you saying, oh my God, we can't record because of this. So
okay.
Yeah. So
I didn't realize there was drama connected to this one.
There was. So
I'm sorry, it was the day, and I'm like, I can't believe you were still so cordial. Like, my husband fell off the roof. Can we reschedule? I'm like, of course, go do.
Yeah. So here we are, like 6 months later. So glad. And I'm actually, now I'm kind of happy that we waited because you've got some pretty big news that we're going to talk about today.
Oh, cool.
So yeah. So let's just jump in. So, you shared with me when we met and we did our little intro call, a little bit about your origin story. And so I thought we could start with that because obviously your passion around this access to care, we talked about that, kind of stems from that. So can you share a little bit about how that experience kind of helped you get Simple Health Kit started, maybe what inspired you, and really any other background information you might want to share with us so we know who you are?
Yes, definitely. So I'm born and raised in Kuwait, Indian Portuguese roots, and we were the families in the first Gulf War, and I'm sure you're hearing it right now in the news. Even Kuwait got attacked recently, but we were those families when Iraq invaded Kuwait. We luckily could escape out, and we lived in the tents in Jordan, getting food from United Nations. Didn't quite make it, so my parents lost everything, and I ended up eating Spam. Unfortunately, I'll never eat Spam again because I ended up getting food poisoning. And there was a little doctor's office, walking on those sand dunes much far away, that they were saying they didn't know what to do. They didn't have enough medical equipment that could get me to health. And so, I was not going to make it as a little girl. And so I was very grateful. My mom, all the people that came on board, they got the plane, they got me to India, got back to health. And I feel like if everybody says, oh, what made you start? I feel somehow, I do believe that was probably what it seeded, that once you experience something so personal, so firsthand, and, I got to make it out faster than most people there. And some of them were much longer in those tents. But I feel that it seeded the mission and the passion of why I needed to learn a lot. I had to study a lot, get all the tools. They got a computer science degree, a PhD degree, and I wanted to make sure that I could learn everything so someday I could help someone. And I feel that root was the stemming of the journey of Simple Health Kit. Fast forward after the war, came back to Kuwait, got to the US, came here for an undergrad in computer science. And then from computer science, I ended up going to University of California, Santa Barbara, where I got into a PhD program, had bioengineering and biochemistry. So I discovered a novel protein, looking at the genetic code, and had to convince.
Novel protein. Okay, tell me what is that exactly?
It's our body's made of proteins. We have DNA, and so I discovered a novel tRNA methylation enzyme, and people were like, what is that? And then it was on the genetic code. I had to convince back then my professor, Dr. John Perona. It's like, I'll learn about biochemistry, and I believe this could be, what we think it is. It has a tRNA binding domain and so forth. And so he was like, okay, and ended up learning everything about biochemistry and proving that it was what we predicted computationally. So
you discover a new piece of what makes up humans, like that we didn't know about before. Code, yes. That's what the novel means, right? Like we didn't know about it before.
Yeah, novel means like new, something.
Right. Okay.
That's pretty wild.
Piece of information, and then now we know what it is. And then, so yeah, so it was really a cool experience. I think that would be my superpower of learning fast and, committed to the mission. And post that, I just felt academic world is great, but sometimes the technology doesn't reach to people. So post my PhD, went to the Silicon Valley, been building, all my life now. My last company, I led product where we used a smartphone. It could help detect if women had preeclampsia or gestational diabetes with protein in the urine. So I'm very passionate about women's health. I know you are too, Heather.
We are too. Yeah.
Yeah, it's mostly what we're about here these days.
Yeah, exactly. And so it was first of its kind. It could take a photo, it would do machine learning, and would say, okay, this person has high protein in the urine, is at risk. We went to the FDA, got the product cleared, first of its kind. And then the company got acquired, and the product unfortunately never made it to the US market.
Oh,
that was
darn.
a bummer. I know. However, I did keep some of those friends really close, and I said, like, hey, let's go do this at scale. Let's go do this at population level and make this technology, this platform accessible to people that need healthcare the most. And, our world we're in the best, I would say one of the best countries in the world, yet healthcare is so fragmented and so challenging and so inaccessible. How do we just give everybody this amazing, we know what consumer experiences are. We have Amazon Prime, we have, Uber, we have great. So what if we bring the best tech into healthcare? And I would say that was Simple Health Kit's vision of being a platform that's end to end. We can screen people for different conditions, connect them to a care so they're not dropped off, like left hanging, and just kind of do this in a way that's seamless and easy for us. But then we decided to go power it to enterprise partners. So we sell to health insurances, health systems, pharma, retail pharmacy, and strategic partnerships where we believe that we can grow if we just have to work together and partner together. So we love partnerships to where we can reach people that need care the most. So yeah.
And Simple Health Kit though started direct to consumer though, right? Didn't it at first? When you like, I go to your website right now and I can see that I can order some of these various kits, like for women's hormones. I mean, STD testing. It was like I just kind of was reading through, but like, how does that work today? So
yeah, believe it or not, actually, Simple Health Kit did not. One of our first customers was the county, was the government.
Oh,
so we actually our original story, I would say one of our early customers were universities, governments, where we were partnering to then deliver the screenings for the patients. Needed. And then people would say, hey, how can I access your screenings? And we said, okay, well, so I would not position us as a direct to consumer. I would say we're very much B2B2C. We still care. Consumers, we live, breathe, and do, but we feel that we can reach people faster by partnering with people that already have like these,
absolutely.
This has been a kind of a theme building in season 3. Like very recently on this podcast, there's a number of episodes where they were guava.
Guava's a good example. Yeah.
They were direct to consumer, but now they're going
through providers.
They're providing to the providers, so the providers can bring it to the patient.
It's scale, right? Yeah. Like you can impact more people in more places a hell of a lot quicker, right? Yeah, I work in that B2B2C space, so I totally get it.
So like when the insurance company buys it from you, like everybody covered by that insurance now has access to your screenings kind of thing?
Yes, free. That's the best part about this.
Free?
Because it's through the insurance.
Well,
it's already paid for.
The health insurance.
It's already paid for.
Yeah.
The health insurance pays us to give you free healthcare at home.
Right, which is good for, right? It's good for population health, right? Like that's what we're talking about. So let's kind of like, I want to like pull back just a little bit though, to get a little bit more specific about like what exactly.
Yeah, now I want to know what kind of, I want to know what kind of screenings I can get.
Yeah, what are we talking about here exactly?
We have a whole suite. I would say our most common screening programs that we do. We have a chronic condition portfolio. We have a women's health, men's health screening. For the chronic condition, which a lot of our partners, the health systems, insurers, pharma, they like we're doing a lot of diabetes screening. If you think of America, 80% of people are pre-diabetic or diabetic.
Yep.
80%?
Yeah, the
Oh my
last
God.
stat I said diabetes, and remember, it can be. Let me get that 80%.
That's a big number. I knew it was bad. I didn't had no idea it was that bad.
It's pretty bad. Yeah, the stats are pretty astonishing. Even with chronic kidney disease, it's something that it's if you could detect it early, it's curable. But if it's too late, and most of the time, a lot of these you don't have any sometimes symptoms, and it could be just too late.
Hmm.
So we are actually in the business of and remember for the health insurance, they don't want to. They don't want us to have chemo and dialysis and all of this. So there's an incentive.
Right. It's
Why
expensive.
Yeah. So for the first time, prevention is top of mind, which I love that we
Mm-hmm.
are now deploying these screenings. And to your question, then the other kind of programs we offer is STDs.
Mm-hmm.
STDs is very stigmatic. People
Yep.
really don't want to go in, talk about it. So we have on CVS, we're like the number one sexual health wellness screening program. We're screening patients for chlamydia, gonorrhea, trick. If they're positive, they talk to a doctor. If they need prescription, they can pick up from their pharmacy of choice. So really, this whole comprehensive platform that we have built, the infrastructure, and now you can layer in any type of screening. So I mentioned the chronic, sexual wellness, cancers. That's where we
Cancer,
Wow.
colon
even colon
cancer.
can. Okay. Yep. I did see that one on there.
Yeah, colon
Yep.
cancer screening, and we'll be launching another cancer screening program in the next month. More
Oh,
to come.
exciting.
So
So
you got all kinds of stuff going on there. Like you can get screened for most of the major things.
Exactly. Exactly.
Yeah.
The biggest ones. So that's why we said the high need, high impact. If you told me, Sheena, go build a diabetes, I'm like, really? But it's astonishing how much need is there, how it's a high impact, high need. That's kind of where we went for the
Right.
targets.
I have a question. So like I'm just thinking about times of my life where I've taken some kind of screening test, and often it will be like going to like a Sonora Quest or something like that. But instead, what you're doing is you're bringing the testing into the office, into the pharmacy, and I mean on Amazon for what it's worth,
Yes.
to the provider's office. Like, explain this to me.
Sorry, repeat that one more time.
I I said it just like how does it show up? Right? Because I'm just thinking about like screenings that I've taken, or even I would even say back in oh my gosh, back in like my 20s when I was using like Planned Parenthood as
Yeah.
basically my PCP, like because I was on the pill and whatever, I was in college. It was great. I remember getting like screenings done there, or like now I go to Sonora Quest and get it. Yeah. So like how?
And so some of them are at home, some of them are not though, right?
Yeah.
Like, can you do them all at home?
We can do both. Yeah, we can do most of the chronic conditions we can do at home, like the diabetes, kidney, even
Uh-huh.
colon cancer. We're doing this at home today.
Okay.
Oh, okay.
Also, STDs are done at home. So yeah, so we have both portfolios and an at-home portfolio as well as an in-clinic portfolio. But the goal was to meet the patient where they are. So
Hmm.
if you were at home and you just 40% of people are not going to provider's office, and usually
Right.
it's too late. So how about we deliver? It's kind of like back in the days you could go to a restaurant and get food, but now we get food delivered to our home.
Now we DoorDash
We
it.
DoorDash it. Exactly. So we
Yeah.
can at least do it for some of these big ones, which early detection or prevention can be prioritized. We deliver care to the patient at home.
So it's really available like it's direct to consumer and it's through the providers and it's through the insurance companies. You're really just making it everywhere. You're putting it everywhere,
That is the
which is
mission.
that's a great approach.
Hmm.
Yeah,
Because
if we can find you anywhere we look, that's a
yeah,
great
Yeah,
business model. Yeah.
although you show up mostly through like health plans, the health systems, things like
that's
that. So
correct. No, I
just kind
mean,
of thinking,
correct.
yeah, like I might show up to my doctor's office, maybe, okay, we'll use Northern Arizona Healthcare where I am right now. And I go to Northern Arizona Healthcare primary care, right? So it's like part of that health system. They might say, hey, you know what, Heather, we need to test you for diabetes. Would they give me the kit like right there? Like, would they have it in their office or would they send me home with it? Or Or if it's a
Yes,
telehealth appointment, right? Then in that case, you could just ship it to my house.
correct. But believe it or not, a lot of times I see this with my mom. She lives in Arizona. She goes to a doctor. They tell her to go to a center, but
Yep.
it's, her eyes are giving out, like she's getting on the road, and she'll go. And sometimes the order appointment didn't come in. So the goal is we are now also empowering the providers that, hey, don't ship. The patient just came to you. Just give them the screening right there and there. So yeah, if
Ah,
we're
Yeah.
trying to reach as many providers, as many, touch points patients go to, and make sure we can just power them right there and there, instead of making people shuttle around and
that's
then get.
Yeah, you
awesome.
can skip over a lot of those specialist appointments by just getting the screening done on the spot. There you go. All right.
That's a
To be
good point, Jeremy.
Practical applications. I
I
Yeah.
love
know.
it.
Yeah, and the goal is like, why don't we just do this? All of us should be knowing where we stand,
Hmm.
just because there's so much intervention that can be done um, earlier on. I was just making sure I got the stats for chronic kidney disease. They say 1 in 7 have CKD.
Is wow, really?
Wow.
9 out of 10 don't know.
Is
So
that just America or is that
America,
everywhere? That's just America. That's our
one in
food.
Dang.
7 U.S. adults, about 35.5 million people are estimated to have CKD. As many as 9 in 10 adults with CKD do not know they have it.
What?
Whoa.
Wow.
So
That's mind
imagine,
blowing.
What is
yeah.
it is it a simple treatment for that if you know you have it? Is that something
I
that's
mean,
easily fixed?
CKD stage 1, CKD stage 2, but yeah, there's so much intervention in the early stages. But once you go down that line, you're in dialysis, and I see dialysis centers
Yeah.
all over.
Yeah, it's too late.
Yeah. That's
So, yeah,
crazy.
Wow.
work with.
Everybody get tested. We're about to sell some kits, I think.
Yeah, no kidding. So we're
Not
talking,
about pushing product here, but that made me want to get tested.
I know. Well, and we're talking a lot about proactiveness, right? This is preventative care. I've been in the healthcare, ecosystem industry. I hate calling it an industry, but let's be real.
Yeah.
I mean, it still
It
is.
is what it is.
I've been in it so long now that, okay, that also means I'm old. Um, and I've seen it change. And it was like preventative care we weren't talking about that in like 2002, 3, 4, 5, 6, 7. We're talking, I remember population health started to be a thing at
Yes.
that time. And I was like, what's population health? And was working, anyway, I was working for a Medicaid company. It's actually what became Aetna Medicaid. And I remember hearing about population health, and it was such like a novel idea at the time.
Yeah.
And it's really cool to have seen the whole system change. I mean, your entire company is essentially based in the fact that it's proactive preventative care because screenings are what we need to be doing, right?
Correct.
Um, yeah. So
Yeah.
that's that. I
And
don't what do you see out there? I'd love to just kind of hear your perspective on that.
the what's exciting, I would say, I think we're in the right time at the right place right now,
Mhm.
where that is the center. Even our government is pro, like let's get screened for chronic conditions. And in that model, everybody wins when, right, as I mentioned, we get paid by payers to give you free healthcare at home. Like, amazing. We're making
Right.
your life easy. And we get actually cards from patients. And I was telling you, Heather, I was like, those make my day. Like, it's hard work for any founder, building anything, for the teams that are just building it from ground up. But what's so rewarding is when we'll get a letter or a card and says, thank you, I didn't know my husband had stage 1, chronic kidney. There is a cure, there is a treatment we wouldn't have known. And we're able to change people's lives in a way that's completely changed their course and how it was progressing, right? And yeah, so everybody wins in this business. That's what makes me wake up every day, um, get up and go do this work with the team
Yeah.
that we
Yeah.
have.
Yeah. Keep them from getting sick to begin with. Yeah.
Yeah, then you don't
Um,
have downstream.
what
Yeah.
and big question in this country these days, what about people without insurance? Because a lot of it's covered by insurance, but but you're also available direct to consumer. And if people don't have insurance, what kind of cost is it a totally depends on what kind of screening you need, or is there a kind of a standard price for them, or
We specifically designed it to be affordable, so you can get the doctor visit, the telehealth visit, everything. Like, for example, I think the common STD is under $70, but you're getting a doctor
Okay.
visit, you're screening for 3 tests, you're getting all of that in the comfort of your home versus, you know, going somewhere, then waiting in an appointment, and then paying the medical and bill and your copays, and so you
Oh
see,
yeah.
like, actually
Oh,
thought
less
that,
than $100 for some. Yeah, I mean that's you can't
yeah,
ask for much better than that for medical procedures these days.
yeah, no surprise bills, like,
That's cool. Okay. That
yeah,
that's definitely reasonable. It's
yeah,
definitely
yeah, yeah,
reasonable.
What you know what actually kind of as I was preparing for
He's
this,
looking at your website, right?
yeah, I have it up here right in front of me. I was looking at the tests that you have available, and I'm like, oh, the women's hormone test. So, like, I've actually never had a hormone test, although I am actively in perimenopause, menopause, and I
yeah,
went through MIDI Health, and MIDI Health, amazing company. If I talk about them enough, maybe they'll agree to come on the show.
Yeah.
But they never even. What was great about this, and this kind of touches on this, some of the things that you and I had talked about too, is trust, right? Like, I met with an MP. They
yeah.
they trusted me that I was telling them the truth about all of my symptoms and didn't even request that I get a hormone test. They're just like, here's your prescription for estrogen and progesterone and what whatever else you need.
Without testing your levels first?
Never tested my
How do they know what to give you?
because all the symptoms just why would I lie about it, right? Like why would I lie about all the things that I feel? So they didn't even order me a hormone test. But some doctors do, right? Like where I've
Yeah.
talked to other friends of mine, they have gotten the hormone test. So I'm like, well, nobody ever ordered that for me. I'm like, well, I can just get it from here.
Now you can get your own. I see a men's testosterone test kit on there as well.
So
And
that's kind of nice, right? Like when you maybe when you're not getting offered that test, right? But you're kind
you
of
have,
interested.
yeah,
Wow,
you
there's a
have,
lot of different stuff on there.
yeah,
Sorry.
we just wanted to make it make it accessible, and that
Yeah.
was the reason of, you know, making
Yeah.
it available. And then for some of these, especially for hormones, you want to like also monitor over
Hmm.
time, like if some are
Right.
consistently low and they shouldn't, because we go up and down in our
That's right. We
cycles.
do.
So
It's
if
like a
it's
daily
consistent,
occurrence
if it's
sometimes.
consistently, if these certain levels are low, so we want to be watching them. So watching repetitive testing sometimes is important because you can monitor over time what you're doing.
Hmm.
Like even medication, like are you in good shape? You would also want to know the before and after, right? Yeah,
Yeah.
Yeah.
I'm curious as I'm thinking about this, like the fact that you can show up in a provider's office, right? Where you're eliminating a barrier to care for that patient. You're like simplifying the experience so they don't have to go, choose your own adventure, right? Like what do the providers say? What do these like health systems say? I'm curious to hear kind of like what the kind of how much it's changed their lives because we know they're burdened already. So,
yeah. I would say whenever I love working with doctors. First of all, like they have the hardest job in the world, the biggest hearts, and they have to listen to all our different types of conditions and emotion. So I respect doctors on so many levels. But yeah, and so they can also empathize with the burden of that patient that
mhm,
just, and you mentioned Planned Parenthood. We actually did a study, a clinical trial plan, and they would tell me some of the use cases. The woman had to travel multiple states to get there, and
mhm,
then they may never get that follow up, right? So they understand the value of getting screened right there. Let's get it out, and don't make that patient go through enough burden, enough hassle that they've already been. So it's really straightforward to convince them. Now, I think a lot of it, sometimes the only delay in getting things is sometimes paperwork,
mhm.
administrative work, getting it through, but it's a no-brainer. Providers love it. This is one more thing that they can help their patients do the good work. But also on the business side, there's a lot of value for patients, for the doctors to get those patients screened, um, even on the business side of things, right? So they're getting more, they're diagnosing people that have diabetes or kidneys, and they are risk-bearing providers. They actually get dollars from the payer, the government, to get those completed.
Oh, like Medicare first, like stars ratings and stuff like that. Yep.
Yeah, correct. So you want to be, you have to think thoughtfully. You want to say like, yes, this is the right thing, and you're not. This is not more burden. In
Mhm.
fact, this is actually helping you close some of those quality gaps.
Well, and also too, you send somebody like say to go get a test somewhere else. You don't even know if they're going to show up there or when they're going to do it, right? And a
Exactly.
lot can happen quickly, especially if you're sick. So that follow through on behalf of the patient, it doesn't need to happen because if you're doing it right then and there,
Correct.
or or sending it to their home, for example,
Exactly.
then you have no excuse. Like there it is.
Yeah.
Yeah, it's very efficient. And
Mhm.
And
it's Star Trek again. We're moving towards Star Trek. Like medicine's just becoming more and more like just get it done right now.
Yeah.
yeah,
You can do
and
kind of everything in one place with all these different things that you have now, and it's this is like another piece in that puzzle to me. You
yeah,
can get tested for anything anywhere you are. Well, I mean,
exactly.
I'm exaggerating a little
Most,
bit, but
yeah, most, I can't. Yeah, we can't do everything.
can't do
But
everything. But there's a lot of stuff on
one
that
thing
website. That was quite the list of tests that we were scrolling through there.
yeah, at least the big ones. The one can be game changer for your life, and there was intervention, right? That's
Mhm.
Yeah,
early,
yeah.
early intervention. And you actually brought up a point, Heather, that this is with the work that we're doing with rural.
Yes, that was where I wanted to go next. So I'm so glad. Yeah.
Yes, so we power one of our partners, the state of Wisconsin. We power them with deploying these programs to meet patients because there is not enough facilities and brick and mortar that they can even reach or access. So
Hmm.
patients are challenged to even come there. So we can actually deploy these, enterprise government programs where we are meeting patients where they are. So we're very excited about some of the programs going in rural transformation of health that we are looking to kind of scale a lot of that efforts to now reach Americans wherever they are.
There's
Yeah.
definitely some counties in Arizona that could use that.
Oh, totally. And just so everybody knows, we're talking about the Rural Health Transformation Fund. I think, am I saying that right? It was
The
like 10
collaborative.
or yeah, collaborative. It's $10 billion, I think, right now that was issued by like state, like you had to, like states had to apply for the program, companies could apply for the program. Did you get funding through that? Or
We are
are you just working with people who are being funded through that?
The Rural Health Transformation Program is a 50 billion
Or
program.
50 billion? Okay, thank you for confirming
Yes,
that. Yep.
they're deploying it to every government, and within the
Right.
government, every state. Then they're giving it to all the different organizations, and primarily are the hospitals, community
Hmm.
health centers. So we are partnering with the community health centers and the hospital systems, and everybody part of that in these different states because it's a
Hmm.
very state by state program. But
Right.
we are in strategic conversations of how can we make this even on a
Hmm.
national scale, given that we
Yeah.
all have a national presence where
Hmm.
we are today.
Yeah. And this was part of the big, beautiful bill, this fund. I actually, because my now previous company that I was with, we were some of the recipients are working in that. So I was learning quite a bit about it. So there's one really good thing that came out of that. So yay, that's exciting.
I'm glad something good came out of it.
Yeah,
Yeah.
and rural healthcare is getting a glow up. I keep saying this, like we're finally seeing some like support. And truthfully, I think it came out of COVID. For good or for worse, a lot of things came out of COVID that showed and revealed all of the gaps in the systems
Yeah.
that we have. So
Yeah.
you're
And,
answering the call with Simple Health Kit.
we want to help. And then the goal is, like I'm all about partnerships. So wherever we can play a piece to help,
Uh-huh.
be the last mile or be the hands that reach beyond the walls, right? That's the way you should think of Simple Health Kit as that vehicle to do so.
I love it. And you said you were working with community health centers and like FQHCs and stuff like that. You're partnering with them also? Or sorry, federally qualified health centers for those of you who do not know what FQHC is. Sorry,
Yes.
there's my industry speak.
We do a lot of work with Native American communities and
Oh, I love that.
actually also with these FQHCs. They're very culturally, they're in the community. They
Yes.
trust with the community locals. Actually,
Hmm.
we did a really exciting program with Whoopi Goldberg. She actually helped raise awareness for screening for women's health
Oh,
for Native American communities, and we did that was exciting part of. So we have an impact arm part of Simple Health Kit that goes out in the community, sometimes physically on the grounds, when like in Louisiana, New Orleans, when 50th in healthcare will deploy to HBCUs. So part of these kind of programs, we did a Native American FQHC program. We did HBCUs with Walmart Foundation programs. And that's us trying to say, how do we give back in communities? As you know, we're the platform and we'll power a lot of these foundations to kind of go do this good work.
Oh, I love that.
That's great.
That's so cool.
Yeah, the native health stuff is big for us too, because we're in Flagstaff. We're a border town with the biggest Indian nation in the country. So you know,
Mhm.
Navajo Nation's the biggest, most populous in the country, and we are the border city on
Oh,
this side of Navajo Nation. So yeah, that's actually a big thing around here. So that's good to hear.
Yeah, so true. Um, yeah, especially too, and you think about like the Indian Health Center too, right? Like I think that's
yes.
out in Winslow. And again, really close to the res as we call it here. So, and diabetes, obviously, like thinking about what Simple Health Kit does, diabetes and liver,
Yeah.
that's chronic kidney
It's a big deal up there.
condition. Like those are big problems with the Native American population. So.
I mean, the more I learn, I think I have more and more and more empathy of some of the also the challenges, the different
Mhm.
communities.
Yeah,
So I definitely, in everything we do, but part of the Simple Healthcare platform, we also do engagement. So the content that goes out to a Native American or content goes out to a Chinese is very different in engaging those populations
Oh.
to drive these programs to actually get done, right? How do you build trust within those communities? And we actually took those learnings and we baked it into our engagement strategies, how we're engaging different populations and different communities that need care. So I would say that is, and like I said, you know, it all seeded initially with some of my roots and upbringing and all these different cultures, and I kind of made that to be like the center. Like, not everything fits one. Like, how do we tailor it to
Mm-mm.
a 20-year-old or an 80-year-old? It's different content, it's different messaging, it's different kind of tools we need to think through to build trust again.
so
And
yeah,
especially in healthcare, because healthcare is entirely based in trust. So, and I love you that you do that. And it's like my favorite, well, because I'm in marketing communications. Like this is the kind of thing that I do. And not every, I mean, truth be told, most companies don't
Take
do
that
it
in.
quite like that. They really don't, unfortunately. So, you know, like take note, people. Like that's how you're right, culturally sensitive. You can't just write one thing
And just
about
hope.
this test or the education piece and send it out to everybody, and they're just not gonna, yeah, they're just not gonna read it, or they're not gonna care. It's not gonna speak to them. It's not gonna resonate with them. They might be going, ugh, they're just a bunch of liars, right? There's that trust factor, especially in the healthcare system. I think that we have. It's kind of
yeah, and especially
troublesome.
as you scale up like that, if you really want to bring it to everybody,
Mm,
everywhere, all at once, then yeah, that really is the sort of thing I guess you got to start thinking about.
yeah.
I'm
Um,
I'm gonna share something that will hopefully blow your mind. Is that part of, as I mentioned, this engagement that we've been spending a lot of time building? We launched our AI concierge care solution. I live in the Silicon Valley, right? It feels like only certain people can get the hand holding through the whole journey. So now with AI coming in, we've been able to productize an AI agent that is calling, engaging patients, individuals in the language that makes sense. So this if it's talking to a Spanish speaker, it will call that individual, call them in Spanish and let them know. We're sending a screening for them, making them easy. Do they need help doing it? Really hand holding them all the way. So that was something I wanted to kind of announce that, how do we use AI in a thoughtful way today with healthcare
Yeah.
in really getting people to the table and getting this care? So now it's not just, the traditional box shipped to your door and it stays there, but now how do you really engage them and then give them the support they need through the journey to end-to-end care?
That is really cool. Is it like an AI nurse type of thing, or do you say AI? Okay.
Yes.
I was just again my
So you
Or
get your own personal assistant along with your
that's really
exactly,
testing.
cool.
exactly. And that will understand your language.
This is Star Trek.
Yeah, who speaks your language? I was just again a previous job. I actually was doing we were doing some work with that, and it's fascinating. Like AI can be kind of scary and overwhelming, right? Like, and AI is not all good, but
Yeah.
for healthcare, like it's a game changer. It for reasons just like this.
Yeah.
Yeah.
So
I love it. And I'm, think about it. There's not enough call centers, call support, call
yeah.
everything. And so this is one way where, you know, it's thoughtful. Again, it's an added benefit. Uh,
Hmm.
So is the AI tied in so that like if there's like an actual situation developing, these people need attention fast, will the AI actually like call 911 kind of thing, like actually
it
alert
will
somebody to
usually
that?
connect them to like the clinical court care coordination team. So if it sends like, oh, emergency, it's not just a regular call of guiding them through. It knows when to escalate, and then it stays within compliance. So that's very important with our partners. Is like we're in healthcare, we
Hmm.
have to be very compliant. It has
HIPAA,
guardrails.
HIPAA,
Yeah,
It has
it's
guardrails.
everywhere.
You can't go
right?
thinking. Yeah, yeah, yeah. So
So
That's
many
cool.
things.
That's cool. That's a great
So
feature.
that just launched.
yes. So
Congrats. That's a big one.
that is a big one. So I saved it for you, Heather, for
Oh,
health.
Oh, we got the
hey.
exclusive. Look at that.
I
You heard it here first, everybody, on
that's
the Uprising.
that's right. That's right. We're here.
Changing the world, man.
Well, and speaking of other big announcements, now this one's obviously pretty public already because that's how it reminded me to reach out to you and be like, hey, I need to get you back on the show. Mark
Yeah.
Cuban's Cost Plus Drug Company. Can you tell us about what you're doing with Mark Cuban and that whole world, which is so cool? I love him and I love everything he's doing. So,
Yes. We all love Mark Cuban. He is definitely a game changer, right? And he speaks his mind
oh,
and
yeah.
um, legendary for sure. And he's always been a champion of transparency
Yep.
and affordability and just bring care to people when they need it and where they need it. I would say on the mission, fundamentally, we were aligned on. We believe in bringing the screenings and engagement and deploying all of these programs, and then Mark Cuban with the pharmacy so they talk to a doctor on our platform, and if they need prescription, the individual has a choice of where they want to get their meds. So that's where the tie-in comes on that platform. They have a choice. They can go to any pharmacy of their choice, including Mark Cuban's pharmacy of the choice. So that is where we wanted to make sure the individual, because you're sometimes going through a journey and you're only sometimes limited by the options you see. We wanted to make sure that no, you're not limited. You can then pick where do you want to get your medications from. And so in that strategic partnership, the whole end-to-end system now is really affordable, transparent, and being delivered in a way that's very thoughtful to the end user.
So this is the second company that's come on this podcast that's working with Mark Cuban. I think that means he has to come on the podcast now, right?
That'd be
Pretty sure
amazing.
that's how it works in this world.
His
We need to
team,
make that.
his business development team is amazing too. Yeah.
Yeah, I follow all his stuff, so really love what he's doing. So pretty exciting for you to be partnering with him and just aligned missions, right?
And just
Access
helping him
and
scale, I would think that's huge. Yeah.
yeah, just and access and like you said, transparency, right? That's what like we're like it's mind-blowing to me, right? Like in healthcare, and it just this comes up all the time. How can you be like, yeah, I need to have this procedure done, but I don't know what it's going to cost, or I need this drug, or I don't know what's going to cost until after the fact.
Yeah.
Yeah.
Like we need to get better at that
Right.
because it's not cheap.
And even on our retail journey, like there is no aha, like gotcha surprises. Like the price that you saw on that, like, I think it's $68. You're getting
Hmm.
chlamydia, gonorrhea, you talk to a doctor, all of that is just included. It's not like you pay
Yeah.
now, there's another bill here, and we just wanted to be transparent. This is what it would cost, and we include that visit. And now with this partnership, they have the choice to pick their trusted pharmacy. And so
Hmm.
that would be that's very excited about that.
Well, I would like to ask, I can't go an episode without trying to cause at least a little bit of trouble. So I'm going to ask a brass tacks question of you. What's the efficacy and accuracy of these tests? Like, because I've actually heard from nurses since I've started this podcast. I have some friends who are nurses, and I've brought up Cologuard and things like that, and they roll their eyes, and the false positives, the false negatives, they don't like it. So I'm wondering, compared to past companies and past tests, what
Yeah.
kind of accuracy and efficacy are we looking at with your test kits?
Great question. And by the way, we don't do Cologuard. So
Oh, I
no,
know, different thing. I'm
They're-
not
they're-
trying to equate.
they're-
They were like the first ones
right,
to
exactly.
do that,
I
but
did it my way.
they actually have a bad reputation with the medical professionals that I know
I
don't like
didn't know
Cologuard.
that.
Yeah, they don't like
Did not
Cologuard.
know that either. But
Apparently,
yes,
there's a lot of false negatives,
Mm.
which is the one they really don't like. There's false positives as well, which is annoying, but the false negatives is bad because then people think they're okay and they're not.
Okay.
wow, you know your false positive, false negative, sensitivity, specificity, biochemistry
Apparently.
language. That's great. So all our tests are clinical grade. So we have a CLIA CAP accredited labs, and CAP is the highest accreditation that a clinical laboratory gets, which is rare. The other thing is we also have licenses in all 50 states. To get a New York license is really, really difficult for anybody.
Everything's harder in New York with healthcare. It's healthcare.
Everything's harder in New York, period.
It's New York and California. They're always the two toughest states.
Yeah.
So,
Our chief scientific and regulatory officer is from the FDA.
oh,
So
wow.
Oh, nice.
Okay.
he runs all of our compliance and regulatory and check boxes. So that is something we take very, very seriously on high quality, and especially with the kind of organizations work and definitely the people that we serve. But yes, on the sensitivity specificity, obviously based on the tests, it's usually in the high 90s that this is
Nice.
able to, if they had to go to a physical location, and we do all sorts of studies. We do the sensitivity, specificity, precision, reproduce. We also do usability studies. Can someone with a fourth grade, fifth grade reading level, can they follow instructions? Can they do it? So we do transport. So we do a lot of extensive studies to make sure this is really, really, really robust from a clinical standpoint. And remember, this is all coming into a compliant laboratory. And that's the good part of our system, because it's end to end. It's very, quality is the center of everything we do.
All right. 90+% is about all you can ever ask for from something like that. So that's pretty good.
That's awesome.
Yeah.
Well, there you go. We've got it's legit, and
I tried to cause trouble.
you
Didn't
did.
work.
It didn't work. Didn't work. Now I'm thinking, shoot, do I need to go get a colonoscopy because maybe my Cologuard test wasn't correct? Now you've put all
You
this
thinking about
doubt
my
into
kidney?
my
I'm
mind.
sitting here thinking about my kidneys. You're sitting here thinking about your colon. We're not going to be able to focus on anything for the rest of the day.
Well, go get screened, everyone. Get your preventive care.
I'm going to get my kidney test now. 1 in 7.
I joke now. I'm like, we're at the age where we're like, we talk more about getting our what do you call it? Colonoscopy colonoscopy than we do, like, people are getting married or having babies, and we're like, oh, did you go to get
medical
your
procedure.
colonoscopy? It's like every week one of my friends, we're sitting around after you've asked them for their readers, and you're like, oh, are you getting your test done next week?
The age has, it's made it much more younger people are
Yeah.
getting screened for now colon cancer. So
Yeah,
actually-
which is good.
March is colorectal cancer awareness month,
Oh,
Was it really?
hey, there you go. It's like we
And
planned
March-
it.
and March 12th was World Kidney Day. So
Oh.
both
Oh.
have something. That way.
Good to know that. I want to ask you a question before we wrap up here, as I'm watching the time. If there's one thing you could fix about how patients experience healthcare today, whether it be rural, urban, what would it be?
That's a big question.
And from your perspective, and I think you're fixing one of them, truthfully. Like, I'm just going to say that.
Yes.
You are.
I would say what we're fixing is what I feel we just started the journey out there, even though we're
Yeah.
working with all of these national payers and great partners. There's still a lot of need. There's still a lot of need to just access basic care. And we're in the business of partnership. So more and more organizations we can partner with to go do this work. Let's do it together. But I would say the biggest is still bring access to. They need to know that we exist. We can help them. So raising awareness. That's why I'm here. Raise awareness for getting your screenings done, because it's early is better than too late.
Right. And a lot less money.
Yeah. And then and the continuity of care. So that's where we see is not, don't drop them off. Now you found them positive, now what? And unfortunately, that's been the traditional ways. We are in a tech world. We are in a tech age. We have now AI everywhere. Like, how can we be thoughtful to really still bring the humanness about our experience, leverage it to do good in the world? So I would say, yeah, access is still a big number one focus that I would want to make sure everyone, no matter where they are, how old they are, whatever demographic they are, we are able to provide care in a way that's human and empathetic.
Yeah. Healthcare is human care. I like to say that as often as possible. Well, great note to end on. With that, partnerships being, I think, maybe your number one here for how Simple Health Kit can show up in more offices and hospitals and community health centers. If anyone listening is interested in working with you, and we know you can also buy the kits directly on Amazon and through the website, but
I'll make sure all those links are in the show notes.
And we'll put it on the show notes. But how would somebody get a hold of you online if they're interested in partnering with you and understanding how you can work together?
Easy. You can always reach me. There's a rule I heard, and it's true. Mark, if you can send an email to Mark Cuban, he will read it. I think he mentioned it on one of his podcasts.
I don't even read my emails. Nobody even sends me emails.
But yeah, similar. You can send an email to myself, Sheena@simplehealthkit.com. I will read it. And the other piece is, obviously, you can come to the website, simplehealthkit.com, and there's a DAMES up page. Yeah, okay. So direct access to myself, Sheena@simplehealthkit.com, as well as on our website.
Okay. Are you guys on social too, like Instagram, Facebook, anything like that?
On Instagram, I would
LinkedIn.
Say LinkedIn is probably where home is for most of my time.
Yeah. I was gonna say you're probably linked. I love LinkedIn. It's like my home away from home.
That's where the industry really lives.
It is. Yeah. Well, awesome. This has been amazing. I'm so glad we finally got you on the show. I'm so excited that you shared your big news for us. Yes. And that we could talk about your new Mark Cuban teams up. So
I'm going to get my kidney screened just so I can have my little AI assistant. I've always needed an assistant.
I love it.
My buddy Nick over here doesn't do much for me,
Well, this is the spirit of awareness. So thank you guys for hosting. I appreciated the conversation. Thanks, Jeremy.
Yeah,
thank you. Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.